How you doing, everyone? My name is Jose Hernandez. I'm with United Spinal Association's New York City chapter. Just want to say a couple of ground rules or housekeeping rules. We have a Q&A feature. If you need to ask a question, you can put it in the Q&A or in the chat. I'll be monitoring both. And we have closed captioning available for those who need it. And we have this service called Otter AI that does real live transcription. I put the link to that in the description. And Karen, if you want, you can take it away, introduce yourself, and tell us about your product and company.
You have disabled attendee screen sharing.
I can do that.
I guess we should have tested it.
It's simple enough to fix. I should be available now.
Okay. How do I see? Let's see, application window. Usually I am able to share pretty easily with this. I don't, maybe there, are you seeing that?
No.
Oh. Okay. Because usually, let me cancel here again. So I don't want any of those.
Do you have your PowerPoint open?
Yes, I do.
Should be one of the windows that are there. Or share screen, but that might share everything.
Yeah, so when I pull up share screen, it says your entire screen, application window, Chrome tab. So it's not on a Chrome tab. So I thought maybe my entire screen, but I'm sharing my same screen.
And then you go to switch over to your PowerPoint. Yep. And then
all right, see it now? Okay. Excellent. Okay, so everybody can see that now? Everybody's good?
Yeah.
All right, so yes, okay, hello and welcome to today's presentation. As Jose said, my name is Karen Spriggs. I am a nurse and I am a clinical consultant for Coloplast, which we'll be talking a little bit more about our catheters and our anal irrigation system in this presentation. But I am also going to do a little background on kind of neurogenic bowel and bladder and spinal cord injury. We are going to be using this poll everywhere questionnaire today. It is an anonymous poll, even though they ask for your name. It does not ever come up as your name. So it's really a great way to make this presentation virtual, but interactive as well. So you can either, sign on online with pollev.com/Karen Spriggs 876, or text with your phone to the number 22333, and then in the message box, type Karen Spriggs 876. So I'll give you a little bit, every slide that we have a poll everywhere, it has these same instructions on it. I just like to give it to you in the very beginning here. So again, as I said, today we're going to discuss spinal cord injury and the impact it has on your bowels and bladder, along with new technology available. So this is the first poll everywhere slide. So if you can just tell me where you are located, that would be fantastic. Just type in the city that you're located in, and you can see at the top it has the instructions again. Bronx, excellent. Long Island. All right, well, we're going to go on. I know that you guys are all from New York. Just to let you know, Harrington Park, New Jersey. I'm outside of Baltimore, Maryland. So as I was talking earlier, I do have a nice sunny day today. We're in the 50s, so we might be a little bit warmer and sunnier than you guys are up there. Oh, Connecticut, yay, thank you. So this session today is for educational purposes only. And if you learn anything on this presentation that you want to talk to your health, I would strongly recommend that you talk to your healthcare providers about anything that you find in this information today. So we're going to first discuss a little bit about spinal cord injury and just getting a glance at what's going on with in your system, basically. Just to know, you're not alone. There are more than 294,000 people in the United States alone that are suffering with a spinal cord injury, and there are about 18,000 new cases every year. Vehicle accidents and falls are what comprise about 70% of all the causes of injury. And as you can see on the pie chart here on the left, about 67% of all injuries are considered incomplete, whether they're tetraplegia or paraplegia. But even incomplete injuries can have some sort of bowel and bladder dysfunction. So my next question is, what is your level of injury? So if you can just type A for cervical, B for thoracic, C for lumbar, D for sacral.
There's actually choices. You don't have to press A, B, C, or D. It says cervical, thoracic, lumbar, or sacral. So all you need to do is click on it. Or you can text it, right?
Yes, absolutely. There we go. I think it's finally, I'm trying to put my answers in too. So I said I had a sacral injury. There we go. More and more people, a couple more people. I know it takes a little long sometimes to get the responses to come up. But thank you for those that are participating. And again, I mean, you can certainly even type it in the chat function, and Jose can even let me know if there's anything, and if there's any questions too, certainly type it in the questions throughout this seminar, and Jose will let me know to stop and answer a question or two. All right, so we're going to go on to neurogenic lower urinary tract dysfunction, or NLUDT. And what does it actually really mean? So the central nervous system is made up of the brain and spinal cord. The central nervous system sends electronic messages to and from the brain and to and from various body parts. The brain and spinal cord communication is essential for healthy bladder function and bowel function too, especially controlling the release of the urine formed so it does not back up into the kidneys, causing damage. The bowel and bladder reside in the sacral region, so all the way down at the very bottom, like pretty much considered your tailbone. An injury at or above the sacral area of the spinal cord can have impact on normal bowel and bladder function. Obviously, disruption to the central nervous system messages to and from the bladder may result in urinary incontinence, which is failure to store urine in the bladder, or urinary retention, failure to empty urine out of the bladder. If left untreated, both of these urinary issues could lead to significant health issues such as, but not limited to, high blood pressure, secondary vesicoureteral reflux, where the urine goes back from the bladder back up into the kidneys, hydronephrosis, which is a swelling or the extra water, the urine stays on the kidneys, renal failure, when the kidneys fail to continue to filter the urine down into the bladder, skin breakdown because of urinary incontinence or fecal incontinence. You can have skin breakdown on your area there. And then again, just the social stigma that's related to involuntary release of urine or stool. So neurogenic lower urinary tract dysfunction is one of the most common secondary complications of spinal cord injury. And why does this matter to you? It matters because common clinical complications such as urinary tract infections, autonomic dysreflexia, and of course incontinence may occur. It can also have a social or emotional impact on your quality of life and sexuality as well. So the function of the bladder relies on the intricate communication and coordination between the brain and bladder muscle and the internal and external sphincters. During the filling phase, kidneys filter the blood and make urine. Urine flows from the kidneys through rhythmic contractions of the ureters and into the bladder. While in the storage phase, as in when the bladder is filling, the bladder muscle receives messages from the spinal cord to relax the bladder muscle and contract the internal and external sphincters to prevent leakage of urine. The receptors along the bladder wall get stretched as the bladder fills, and once a certain threshold is reached, a message is sent to the brain and urgency is felt. Once this urgency is felt, the pelvic floor muscles and external sphincters are able to voluntarily contract until it is socially acceptable to relieve the urine. During the emptying phase, once it has been decided that it's time to empty the bladder, the internal and external sphincters voluntarily relax, and then triggers a message to be sent to the brain so that the bladder muscle can contract, and then those internal and external sphincters are now relaxed to release the urine. So the location of the neurological lesion determines which phase of this reflex is altered, and we'll discuss this on the next slide that focus on that bladder function. So as you can see from this slide, the level of injury tells us a lot about how the patient's bladder will act. From the cervical level down to the lumbar area, as you can see over here, above the S2, that's where the bladder is hyperactive and will result in urinary incontinence, okay? So anything below that in the sacrum and the coccyx area, the bladder will be underactive and you'll have urinary retention. So typically with either one of these conditions, you'll probably end up needing to have some sort of way to empty your bladder. So which we're now going to discuss bladder management options. So the goals for any bladder management program are, number one, and most importantly, to keep your kidneys safe. We do not want you to get into renal failure. So it's very, very important to drain your bladder so that your kidneys remain healthy. We also want to minimize complications such as urinary tract infections and trauma to your urethra. We also want to decrease or eliminate incontinent episodes or urinary incontinence episodes to allow for you to get back into society in the way that means most to you as an individual. We also want to improve the quality of your life by decreasing bladder interference, so management options and controlling incontinence. And of course, we want you to return to the activities you enjoyed pre-injury, returning to fun, having a good time. So clean intermittent catheterization is still considered to be the gold standard for neurogenic bladder management options. And current guidelines speak to the fact that CIC, again, clean intermittent catheterization, ensures better bladder health and may lower the risk of urinary complications compared to other treatments, such as an indwelling catheter, which you might have heard of as a Foley system, or even a suprapubic tube. It also gives patients a greater sense of freedom and control, which we know is a better key to quality of life. And also by allowing the bladder to empty and fill and empty periodically throughout the day, mimics how a healthy bladder would act and helps contribute to improving quality of life by providing bladder control and social continence. So intermittent catheters allow for routine bladder emptying. And the rationale behind intermittent CIC is that it provides, again, a method of emptying the bladder periodically, typically every 4 to 6 hours throughout the day, but this is usually determined by your healthcare provider. So by doing so, though, helps avoid urinary retention, overflow incontinence, and potential leakage between any voiding episodes. CIC of the bladder not only empties the bladder, but also allows the bladder to fill back up again between catheterizations, again, helping to maintain that muscle tone within the bladder wall. This is all accomplished without leaving a catheter in the bladder or urethra, again, which decreases long-term complications such as urinary tract infections and skin erosion around the catheter, things of that nature. And by frequently emptying the bladder, end users are able to decrease the frequency of the lower urinary tract complications and prevent overdistension of the bladder and subsequent reflux of urine back up into the kidneys. So again, clean intermittent catheterization is the preferred method and means that the intermittent catheter is removed after each catheterization episode, and it puts control back into the end user's hands and not being tied down to a Foley system or a bag Foley, catheter and bag system. So again, the goals of intermittent catheterization are to empty the bladder frequently enough. And typically most healthcare providers want your volumes to be between 300 and 400 cc's with each catheterization. Again, help to ensure social continence and decrease any fears of accidents while you're out in the public, and help to improve quality of life by controlling when and how your bladder empties. And ultimately, a healthy bladder management option is only as good as the patient is compliant with the prescribed regimen at home. So it's really up to you guys as the end users to continue to be compliant with your prescribed regimen. But convenience, discretion, and ease of use are really big features that most end users really want to have in their life. So we're going to talk a little bit more about convenience, discretion, and ease of use of our catheters in a little bit. But our next poll everywhere slide is, what type of cathing system are you using right now? Are you doing clean intermittent catheterization? Do you have a suprapubic tube in your abdominal wall? Are you using an indwelling catheter, which is considered a Foley catheter? Thank you for answering. Anybody else want to answer? All right, well, like I said, I'm not going to spend too much time because I know we have a lot to go over today. I'm kind of surprised that nobody did answer CIC, though, because I'm hoping maybe we can find you an alternative to what you're using right now if you're not using CIC. And then if you do, so actually nobody answered CIC, so I'll just skip this question. But if my question for this was, do you, oh, yay, none of the above. Okay, good. So then that's probably it's probably Jose is the only one that's answering me. But yes, thank you. Whoever answered the none of the above, you're probably the one that answered on the previous slide that you have a suprapubic tube. Excellent. So again, catheters. Regarding catheters, we at Coloplast know that one size does not fit all. So we are going to take a closer look at catheters now. And in the next few slides, we are going to discuss the clinical importance of choosing a catheter. So I'm sorry for those of you that are not using CIC, but maybe if you see some alternatives, maybe you might think about trying to use an intermittent catheter as compared to a suprapubic tube or a Foley system. So intermittent catheters, there's so many choices to make. Where do we begin? A catheter is one of the most used invasive medical devices that is used across the healthcare continuum. The next portion of this presentation will look at the materials used in intermittent catheters, as well as features of the catheters, including the tips, the eyelets, the coatings, and catheter design. Each of these play an important role in catheter function, ease of use, and decreasing potential complications and patient compliance. So the French size is determined by your healthcare provider. My background was that I was a pediatric urology nurse. So, I typically stayed on these smaller sections, the 8s and 10s and 12s as they got into the teens or tweens. For those of you that may be doing CIC, most commonly for the adult population, you may be using 12 or 14 French. But every single catheter manufacturer uses this same chart here. They use the same colors for every single one of the funnels that they create. And on this picture, you can see that the red catheter here would be an 18 French. And the French size is the diameter or the circle, the part, if you would put a measuring stick around the catheter itself, that's the French size, okay? So there are different types of coating choices and you need some sort of coating on the catheters for insertion and withdrawal to make the catheter slide in and out of the urethra more easily. So the uncoated catheter, a lot of people are familiar with. There's no coating at all on the catheter surface. You have to add a water-based lubricant to it, some sort of water. You wouldn't use like a Vaseline or any kind of that sort of stuff. You would need a water-based lubricant to be added to the catheter. There are a couple problems with uncoated catheters, though, when you add that lubricating jelly. Number one, a lot of times it does not follow the catheter in and out of the urethra. If you use it, you know that it ends up on the floor, on the toilet, on your pants, on your underwear, wherever. Another interesting fact is that you as a patient may end up having to, if you have, private insurance, you end up actually a lot of times having to pay extra because your insurance company has one code for the catheter and one code for the lubricant, whereas folks that are using gel-coated or hydrophilic catheters don't have to buy the lubricant and then therefore have actually less out of pocket. Again, that is if you have private insurance. There are some catheters that are called gel-coated, where the catheter actually comes pre-lubricated and there's already a water-based lubricant on the catheter. I have always found that these are kind of sticky and, didn't feel as slippery as the actual ones that you put on itself. However, it does stay on the catheter a little bit better and does follow it in through the urethra. The latest technology, though, has this hydrophilic coating. So hydrophilic means water-loving. So the catheters have this water-loving coating on them. And then when they're exposed to water, they become very wet and slippery. It's just an amazing process. I'll talk in a little bit, I'll talk about our transanal irrigation system, and those catheters of ours are not lubricated. So whenever I'm doing a training with a pediatric patient on that, I always tell them it's like Harry Potter magic, because it's nice and smooth to begin with, but then you add water and it becomes very slippery. But, some of these catheters, like the Coloplast catheters, are ready to use. The coating is already activated. They already sit in water. You don't have to do anything to prep them. You take them out of the packaging and they're ready to use to catheterize your urethra. If you have a Mitrophanoff, it can catheterize your Mitrophanoff as well. There are some, though, not our product, but we do have some of our old technology and some other catheter companies where you actually still have to add water to the packaging or pop a sachet, a water packet that then hydrates the catheter. On those, though, typically you have to then agitate the package for a few seconds to get that hydrophilic coating on the catheter to be activated. Again, as compared to most of our Coloplast products, our Speedy Cath line is already ready to use. You don't have to do any of that. No mess, no fuss, basically. Oops. No, I guess so for anybody that's doing CIC, are you using a hydrophilic catheter, a non-coated catheter, or a gel-coated catheter? Non-coated. Okay, excellent. Anybody else want to answer for us? I guess I can answer. I'll say A.
Sarah also says that she's non-coated.
Non-coated. Okay, great. Thank you.
Deborah says hydrophilic.
Okay, Deborah, yay, hydrophilics. Excellent. Thank you, Jose. All right, I'll go on to the next one. So the next one is the eyelets. So those are the holes at the end of the catheter that drain the urine from the bladder, okay? There are some intermittent catheters that are manufactured with polished eyelets, as you can see down here, and some that are unpolished, okay? Are cold punched. Here's the difference. All medical grade plastic catheters are extruded through a machine to create the tube or the catheter itself. The second step in creating the catheter is to punch eyelets in the tube. Again, this allows obviously for the urine to drain out of your bladder. Many manufacturers will stop at step 2 and consider the eyelet process complete. This would be considered cold punched or unpolished eyelets. However, there are manufacturers, such as Coloplast, that take an extra step of polishing the eyelets to a smooth finish. The goal is to ensure that there are no burrs or nicks or anything of that sort to abrade the urethral lining during insertion and withdrawal of the intermittent catheters. This would be considered smooth polished eyelet. Also, the geometry of the eyelets is a very important factor. And helps prevent the damage of urethral mucosa during insertion and withdrawal of the catheter. The shape of the eyelets and the sharpness of the eyelets are important factors because the mucosa has a tendency to be drawn into the lumen of a wide and conical eyelet, and then the mucosa is drawn into that eyelet during insertion and withdrawal of the catheter, which therefore increases the risk of damage to the mucosa by scraping the eyelet edges. The sharper the edge of the eyelet, the greater the risk of damage. Consequently, the long and narrow of the radial lock eyelet is essentially better than the wide boat-shaped side lock eyelet. And a polished eyelet is essentially better than an unpolished eyelet. And as of note, all Coloplast catheters have polished radial lock eyelets.
Can I
The
just
catheter,
comment?
yeah, go ahead.
I just want to say that also the polished eyelets allow for those of us who have sediment, who develop sediment, it's, flows a lot easier and prevents the sediment from getting caught in the eyelid itself.
Nice. Good. That's really great. Thank you, Jose, for interjecting that. That's great news. So there are two different types of catheter. Well, actually, there's two main types of catheter tips. The most common one is the straight tip, as you can see in this picture up top here. That's mostly what most patients tend to use, at least tend to start off using while catheterization. The other one is a curved tip, which is called coude. Coude basically in French means curved tip. And it was designed to help navigate especially the difficult male urethra. The male urethra, as most men know, it's longer than female urethras. It does have a bend in it. It has to, then you also have prostates, and the prostates grow as you get older, and it's more difficult to pass through that. So a lot of times as you get older, men may need to switch over to this coude tipped catheter to navigate through that male urethra. So there are two different types of coude tips. There's this coude tip that you see here that's fixed. I would call it a fixed coude tip or tapered coude tip. There is new technology that is available from Coloplast that has a flexible coude tip catheter. And this is an amazing catheter that easily navigates the male urethra and gets past all those difficult passageways. And it's completely flexible. And because of that, it just glides in so much easier. It is, however, a very soft catheter. So if you don't have fantastic dexterity, it's not a great option for you unless if you have somebody catheterizing you. Oops, let's see. So do you use a straight tipped or a curved coude tip catheter? Straight, great. See, I'm going to answer B so that I can have a little delineation here.
Yeah, I'm going to assume that
most people use straight. Yeah, agreed. Yep. Because I think everybody on here is very young. I hope. Everybody's probably younger than me. I'm old. So, now I also want to talk about the catheter material. Okay, as you can see on this slide here, there are several different types of catheters. Okay, and it's called the durometer. Durometer is the flexibility of the catheter. As you can see here, the red rubber, which is a latex catheter, is very soft. And I would assume that none of you on this call today use a red rubber catheter because of the latex issues that have been found. If you continue to use latex with urological procedures and catheterizations over time, you sometimes build up a resistance to it and become allergic to latex. So most of the catheters nowadays are made with the PVC, which is medical grade plastic, or PU or PVC. They're both medical grade plastic. There's also some silicone ones too that are a little bit even less kind of in between the PVC and the red rubber latex. But it's just interesting to note that most of the catheters that we're going to be talking about mostly today are of the PVC, the medical grade plastic, and it's definitely a firmer catheter for you guys to hopefully catheterize on your own.
We still have someone here that uses the red one.
Really? Oh my goodness. Wow, that's kind of shocking to me. I just thought that so many people, especially in pediatrics, I mean, we totally got away from latex catheters because, again, especially my population was a lot of spina bifida kiddos that are cathing from the time that they're born until, till adulthood through their lifestyle. And again, just over time, a lot of patients, just with the continued use of latex become allergic to it. So, it'll be interesting, if you want to talk a little bit later on and,
There's two individuals.
Wow. Oh my goodness. That is surprising. Oh my goodness. Ay. Well, and I am also going to show you another reason why maybe you might want to talk to your healthcare provider about going from a red rubber to one of the plastic, medical grade plastics. As you can see from here, so the inner lumen, not the eyelets, determine how fast your urine drains out of your bladder, okay? So it's not the eyelets, it's the inner lumen. So even if catheters have 4 eyelets as compared to 2 eyelets, and the red rubber has the 2 eyelets next to each other, or it's compared to most of the medical grade plastics are kind of variegated from one side to the other, But you can see on this picture how, because of the red rubber, how they have to design the catheter, they actually keep putting layers upon layers of the rubber together to make it so that it doesn't disintegrate, basically. And you can see on this picture how much smaller that inner lumen is compared to the medical grade plastic, because they don't have to build up that plastic as much. And look at how much faster the urine is flowing. So, you may want to talk to your, healthcare provider and say, hey, I found that I could actually finish going to the bathroom more quickly if I change my catheters, right? So the entire Coloplast products, the entire Speedy Cath family uses the latest technology designed for better user experience. We're going to be talking mostly about the products on this side of the screen today, because they are that more stiffer, easier to use if you have a higher level injury. This is the new Speedy Cath Soft that has pretty much the same technology as the Coude, the Flex Coude that I talked about a little bit ago. It has a gripper on it, whereas this has a sleeve on it so that you don't ever touch the catheter itself, but it is a stepwise procedure, which basically means that instead of just opening up the catheter and dropping it into especially the male urethra, you actually, as you can see on the picture on the left here, how they're putting that gripper up closer to the eyelets, then you have to kind of feed it in. So you have to have some pretty decent hand dexterity to use both the Speedy Cath Soft and the Flex Coude. So we're going to focus mostly on our Speedy Cath compact sets, compacts and compact sets. So the first one that I want to talk about is the Speedy Cath Compact Male. So you can see that this is a one-piece item. This is about the size of maybe a long pen type thing. I think I might have it. You can see, I can't see me with my screen up, but if you can see this is the size of the male Speedy Cath Compact Male. Okay, so when you open this, the catheter actually telescopes out and is actually stuck to the bottom of this with a little string. So you do have to tug on it a little bit. But then once it's out, you just take your penis and you drop it right in and use the restroom that way. There is a funnel on the end of it. You can kind of see it on this picture that does connect to a catheter bag. So if you want, or an extension tubing, whichever, if you would prefer this technology, this is a great technology to utilize for if you're in the wheelchair and you don't want to transfer, you can either drain right into a urinary bag or use an extension tubing to drain right into the toilet. So the next slide is on the Speedy Cath Compact Plus Female. So let me grab that. That's what this looks like. We consider this the lipstick catheter, okay, because it looks just like lip gloss, basically. And it is a small catheter. We have two different lengths for females. We have the plus, which most adult females will use, and we have just the regular Speedy Cath Compact Female. These are great because, again, they're very discreet. They also have that stiff technology that's easier to grip. Again, all of our catheters are already sitting in water, so you don't have to lubricate them. This catheter is really cool. I'm going to show it to you. I don't know if you can quite see the end of it, but the end of it is just amazing. It looks like a colander to me. And the reason why we did that is because we actually listened to female patients, and they said that if they're in a stall next to another woman, they don't want to sound like a catheter void. So if the urine's coming out of a funnel, it's coming out in a big stream, almost like a male's catheter. Male urination would. But females, because of our anatomy, we kind of spray a little bit. So this actually mimics that spraying sound more so than the funnel end. So we actually thought about things like that for female patients because we listened to what they said and what they wanted, and that's what we came up with. I think it's just amazing. So the other two technologies that we're going to talk about are the Speedy Cath Compact sets for men and for women. They're pretty much the same. Okay, so I'm going to stay on the female side. I like to call them. In fact, I'll go back one slide for the male. I think I have one of each sample, and again, hopefully you can see these by the way I'm holding them up. So this one is obviously the male, and this is the female, okay? So this male technology is the same as this technology, but has a bag on it. So it already has a bag attached to it. The thing with catheters with a bag on it, a lot of times your insurance company has some specifications that you need to meet in order to obtain them from your insurance company. Sometimes it's just having 2 urinary tract infections in a year, residing in a nursing home, being pregnant for you ladies, or sometimes there are some insurance companies that even with, spinal cord injury in a wheelchair, you're eligible. So, if you're interested in these are another thing that you can certainly talk to your healthcare provider about, because as you can see, they're just amazing. You can easily stay in your wheelchair and catheterize, and the urine goes right into the bag that is attached to the catheter. So you don't ever have to worry about, I know so many of these people, if they're like on a long distance travel or anything like that, they can just cath in the car and nobody has to stop for them to go to the bathroom. It's really kind of amazing technology. So I do have, I don't know if you're going to, let me know if you can hear this. It hasn't started yet. This is an OT from Shepherd that demonstrates our catheter. She's not talking. I can't even hear. There she is. Can you hear that, Jose?
No, we cannot.
Okay. Well, then I'm going to just see if I can just fast forward her to where she kind of shows how she teaches her patients how to use the catheter. She's saying that C5 can do it with a lot of buy-in. All right, so this is the demonstration. I think this is she does such a great job. And I'll close caption. She says that if you most patients will use gloves to open it. I think they're like Dyson gloves. The palm gloves, she's saying.
Those are the gloves that help with the dexterity.
Okay, yep. So she's saying that some patients will have their, caregivers open this up because you have to twist this to open. So, yeah, so somebody will open it, but you can see she uses her teeth to take the tape off and rolls the catheter. And she uses her hands to rotate the catheter. And then she spits out the tape. And then she bites the at one end and uses her hands with the gloves. Oh, let's see. I shouldn't have listened to you, Heidi. Let's see. Maybe.
Sorry.
No, I don't see any place that it says that I can do that. So sorry. So yeah, she's biting it and using those gloves again to rotate the catheter. And then she just rotates it till it opens up and pulls off the end. And now she's talking that we used to have a Velcro circle on this that was really difficult for people to open. So we took that off, thank heavens. And you see how she's trying to use like the big hands. And she says she usually puts it on her leg so that because she's keeping it inside the video to start up to you. So she's saying that she still has gloves on when she has this and her gloves are dirty. Right. And she's saying, be prepared, especially if you're male, getting the pants down And she recommends using a bungee cord to put it over the knee. Or she also talks about our pantler. If you're not familiar with that, we can talk about that. Yeah, she recommends a bungee cord because with pantler and everything else, you'd have to carry around with you. But I would think you'd still have to carry a bungee cord with you. So she's saying that her hands are still dirty. So now she puts that in her mouth and rotates to pull out that catheter. So remember, right there's that little stitch that I was talking about. So now she's got the clean catheter in her mouth. Now she has to wash her hands, hand sanitize, whatever the case may be. And then clean the penis. And then she grabs the catheter with her clean hands. Yeah, and she's talking about that you don't have to touch the catheter because we have that handle up at the top. So then you hold your penis and you insert. And she's saying use that other hand to help guide the other hand into the urethra and into the bladder. She says that what she's saying is that you might need the other hand to guide it in, but most people just insert. And that's why she said the rigidity comes in handy because it just easily slides in. And she's saying hold the pressure in to get all the urine out. Yeah, and she says that the rest is that she's just talking about afterwards. They just for her people, she just tells them to just throw it in the garbage. She doesn't have them open up the bag because the bag basically it can make a mess. So have you ever been told that a catheter you want is not covered or too expensive? I'm just going to go right ahead and say it's not, it's a myth, basically. So you pay for the technology, you pay for the catheter type, not the technology. So every straight catheter is billed out at the same. Every coude tip catheter is billed out under another category, and all the catheters with a bag are billed out at that third category. So because of that, you should never be denied because of a catheter technology. It's because of the DME company or the home delivery company that you're using that they don't want to, they'll get less of a margin basically back from the insurance company with the better technology. Okay. I understand I don't have very much time left, so I think I'm going to even just kind of skip through neurogenic bowel information type stuff and talk about just bowel management program, because I really do want to just talk to you guys quickly, briefly about our Peristeen system. Bowel management can be managed many different ways, but a lot of times there's so many accidents and incontinence and things of that nature with your bowel programs that Peristeen is such a great alternative now, and it does not require surgery. It's basically established and effectively emptying the stool to avoid bowel accidents. It's predictable so that you don't have to worry about, if you schedule it this pretty much the same time every day, you're pretty much almost guaranteed to not have stool accidents after starting Peristeen. This is just, again, the bowel management type programs. And so Peristeen transanal irrigation system is indicated for neurogenic bowel. So spinal cord injury, spina bifida, multiple sclerosis, anybody of that sort. It is required, anybody over the age of 2. It does not matter the upper echelon. There is no upper echelon, but the patients do need to be at least over the age of 2. It does require a physician's prescription, and you do need to be trained by a healthcare professional. But it is portable for travel and in-home use. It's just an amazing product. And basically it just assists with the evacuation of feces from the bowel by introducing just plain old lukewarm tap water, nothing else, just lukewarm tap water with a retention balloon that goes into your rectum. and you put the water in and it flushes the water and stool out. Typically, most patients start off with a daily use of it and then can get to every other day. But again, it's prescribed by your healthcare professional. It can be used a lot of times with people with limited hand dexterity, and maybe independently. You can use it independently or sometimes just with some assistance. A lot of spinal cord injury patients may need help setting it up. But once it's set up, and maybe even if the catheter is in, they can usually pump the water in on their own and sit there and evacuate the bowels pretty effortlessly on their own. And then, a caregiver may help just with cleanup and things of that nature. We do have really decent reimbursement with most Medicaids and private insurance companies. We unfortunately do not have Medicare coverage right now, but it is something that Coloplast is really, really looking into getting approval for. But they tell me, hold your horses, Karen. It sometimes takes 3 to 5 years for us to get that, get that going, get that approved. And, the other thing about the New York Medicaid is that it is at this point just by a case-by-case scenario. So Medicaid looks at the order and the letter of medical necessity, chart notes, things of that nature, and may or may not approve you. We're getting more and more approvals with New York Medicaid, but it is certainly something that we really would like to get more and more approvals of New York Medicaid. If you have any association with the VA or TRICARE or anything of that sort, it is covered through all of the insurances through the armed forces, or like I said, TRICARE for life, the VA system, anything of that sort. So it certainly has been proven to shorten the time that you sit on the toilet, helps definitely with having bowel accidents, gets you back to a normal life, all that sort of stuff. I wanted to kind of quickly go through this just because I want to make sure, see if you guys have any questions about this, about anything that we talked about, and if you want to see anything a little bit more up close and personal that I have on my desk here today. So I'll open it up to any questions or answers, questions, chats, anything of that sort.
Anyone of the attendees have any questions or would like to see the products up close? Just monitoring the chat.
Yeah, I mean, and I do have my Peristeen stuff here too. We do have 2 different size catheters for Peristeen. We do have a small and a standard. Typically the small is for more of the pediatric patients, and the standard is more for the adult patients. Not much of a difference in the length, just in the balloon. With the small, you're really only supposed to do 2 pumps of air in the balloon, whereas the standard, you can go up to 4 pumps of the balloon.
We got 2 questions of
okay.
Demonstration of Peristeen, and how does the Peristeen system work?
Okay, fantastic. So it's amazing. It's such a great product. I absolutely love it. Let me grab so I have a bag of blue water. You don't have to put blue water in your bag if you ever get the system, but it does have a tripod. So what's nice about that is it can set in front of you or on the floor, or you can hang it on the wall. It does not go by gravity. So it's really nice because there's air that goes in the bag and water that comes out that goes into your bowels. This is the system itself. So this is the tubing that is attached to it. So this is where I always think that, some spinal cord injury patients, if you don't have great dexterity, this is where you need help with setting the system up and everything, because there's small holes and small tubing that you need to connect and then put in at like a T with a good push and a quarter turn, and it should be in there good and tight. Okay. And then you set the whole system up. And then this is typically where most spinal cord injury patients can usually function on their own, because if you have kind of a big hand grip, you can kind of turn this on for yourself. Again, you might need some assistance with placing the catheter and that sort of thing. But once the catheter's in and you're on that white for the water, to pump the water, this you can usually put on your leg and lean on this bulb so that it pumps the water into your system. Okay, most patients can just lean on this while it's on their leg and pump the water in until you get to the amount of water that your healthcare provider has recommended for you.
Also,
go ahead.
I was just going to say, before you get it to that step, once you insert it, you have to fill the balloon that's inside.
Right, yes. So sometimes, I mean, again, if you don't have really great hand dexterity to pump up the balloon, that's another time where healthcare, your assistant, whoever's helping you with, bowel and bladder management type things at home, they might be the one to pump the balloon up as well to get the good pumps in the balloon. Let me just quickly show you the balloon. I'm gonna stick. Again, this has that hydrophilic coating on, but it's not activated because we have our own water bag, okay? So I'm not going to pump through the tubing, but I do want to put a little bit of water on there just so that when I blow up the balloon, it doesn't pop. But if it pops, it implodes, okay? So you don't have to worry about it hurting you because it does not, since it implodes, it doesn't explode, so it doesn't hurt your rectal tissue, okay? And it implodes upon itself, so it is self-contained upon itself, so you never have to worry about pooping out plastic pieces.
So it kind of just collapses.
Right. Yep. So you would put it onto the blue for the balloon, and then this is where, and you can see my hand here. That is one pump. That's two pumps. And that typically for adults is what keeps it into your rectal vault there. So it mimics your internal and external sphincter of your rectum, which is deficient, on the bladder and the bowel when you have neurogenic bowel and bladder. So it stays in there. And then once you start pumping the water in, the water comes, let me decrease this. The water comes out of these two eyelets here, basically on the catheter, and it pumps into your rectum. And again, because that balloon's there, it's staying in your rectum. So now the water can stay up into your colon. And once you get to, typically adults, again, most clinicians will start you off at 500 cc's. And once you get to 500 cc's, you would go to the green button, which then deflates the balloon. The catheter will fall out of your rectum typically. Some spinal cord injury patients may need to remove it on their own. Some may even need to do a little rectal stimulation from it. And what I always say is, if you have one of those devices that you use for rectal stimulation, you can use that. Some people are comfortable using their finger, but you also have this catheter right there that you can do a rectal stimulation with, whatever works for you. But so a lot of times when you're doing that first initial water and stool will come out. But again, if you're a spinal cord injury patient that has kind of the tighter sphincters, that kind of stuff, you might have to do that rectal stimulation and then the water and stool will flow out. It is such an amazing product for neurogenic bowel because, again, so many people, lose time at work. If you're still in school, you lose time at school. You're not going on vacations, things of that nature that you just, your whole day is disrupted. I know I talked to one gentleman the one time that, early on when he had a spinal cord injury, he was young and he was going out on a date and he's like, I had to call the date and say I'm sorry, I can't meet you, because as he was getting to the restaurant, he had a stool accident and needed to go home and clean himself up. So this is designed for predictable bowel movements that you typically, again, like I said, you usually start off every single day and then get to, typically most patients can get to every other day. So it's an amazing, amazing tool. And with travel, basically, your kit comes in this bag, and this is all you have to travel with because you use lukewarm tap water. You can use any tap water. Now, I always say if you're going to Cancun and you're not supposed to drink the water, then use the bottled water. Just heat it up, warm up, put some warm water in a sink or the bathtub and put your bottles in there and then fill up your bag. You don't want it cold because that can cause cramping in your abdomen. And obviously, if you don't want it too hot because it could damage your tissues in your rectum. Does that answer all your questions? I know we're running out of time, and I can certainly stay longer for anybody that has more questions. But I know people, if you're on a time limit, we have like 2 minutes left. But I have nothing else planned for the rest of the day. So if you guys have more questions, please feel free. I'm more than happy to answer them on catheters, rectal catheters. Can it be reused? That is a great question. So we recommend not reusing the catheters because of that hydrophilic coating, right? Because it's going to be dry and sticky. In fact, mine's already getting sticky from just being out in the air, okay? So catheters are a one-time use. Every box of our catheters comes with 15 catheters and one bag. So every time you open up a new box of catheters, you need to switch out the bag. The rest of the tubing, including the lid here, and there's a straw that's attached to the lid, the rest of that is good for 90 uses, okay? So once you start using it every other day, this tubing is good for 6 months, okay? One box of catheters is good for a whole month when you're using it every other day. I get a lot of questions too for patients that have Medicare. If you have Medicare and you have a secondary insurance, a lot of times those secondary insurances will pick up the expense of Medicaid. If you unfortunately do not have any access to that, but you don't mind paying out of pocket, there are some groups around, one outside of Philly, that I found them to have one of the most affordable. And if you're using it every other day, it's about $2,700 for the year, which nowadays, you know, your flexible spending, if you have flexible spending through your job, you can get $2,700. So you can, I always say, if you have that availability or that luxury, you can certainly use it to purchase your Peristeen.
So, and
Good
that's
question.
the entire system.
That's the entire system, yes, for a whole year for using it every other day would be about $2,700.
Okay. So if people wanted to get in contact with you, we have your email and we're gonna send out, emails afterward.
Perfect. Yeah, absolutely. Yes. I mean, if you email me, I would have to refer you to our home office folks. And, depending on your question, it would go either to, we have these lovely people called care representatives or care advisors, and we have one specifically for Peristeen and in your area, and we have one specifically in whichever area you live in for catheters as well. So those people, if they have questions about catheters or Peristeen, depending on which questions they have, I would refer them to those particular people up at home office.
All right. I want to thank you, Karen. Thank you, Heidi, and thank you everyone who attended. And again,
Yes,
if you have additional questions, you can contact me or
perfect.
Reach out to Karen.
Yes, thank you so much. Thank you, everybody. It was so nice being on today.
Thank you very much.
Thanks for having us, Jose.
Yep. Thank you for joining us.
Excellent. Thank you so much. Bye-bye.
Bye-bye.